Yo, welcome back, Dental Lighthouse Podcast, and have some thoughts that I wanted to share with you guys regarding, let's call it, low performing associates. So it's Monday. I'm putting together all my notes from my private coaching calls over the weekend, and of the 4 or 5 calls that I had, 3 of them were focused on lower producing associates in some capacity, right? There's just a lot to unpack about lower producing associates. So I thought it would be a great idea to give you guys a framework of things that I think about in terms of how can I help my associates become better producers? What is exactly my responsibility? What is their responsibility? And what do neither of us have control over? So, um, as someone that loves to take ownership for everything, I think we'll start with what I feel like I'm most responsible for, and what I feel you, as the owner of the dental practice, is most responsible for. So, first and foremost, I think we need to define success, or in my world, we call it winning, when it comes to evaluating our associates. So, what defines an underproducing associate? It's too ambiguous of a term, too subjective of a term. So, there's no right or wrong here, but let's have clarity on what exactly performing well versus underperforming is. Um, and again, I can only give you the context from my situation, my experiences, my brain damage. Um, so let's start with the non-negotiables of winning. So my non-negotiable first is the associate has to be a core value fit. And if you don't have core values listed out, and if they're not well defined, then that's where you need to start, because it's very difficult to evaluate someone as a poor fit or underperforming if you don't have clearly articulated and defined core values. By suggesting that your associate is not humble, yet humility is not one of your core values and it's not well defined, that's not fair to the associate, in my opinion. So that's where it starts. That's a non-negotiable. So have core values that are clearly defined and articulated well, and you live them, right? They're not just on a T-shirt or a poster. There's something that there's something that you're talking about all of the time. So that's the first thing. The second thing is, I'm not driven by money, but we have to clearly define what winning is for these particular doctors. And when I get on coaching calls from owner docs and they say that the associate is underperforming, it typically means revenue. It typically means adjusted production, right? So, what is good adjusted production for an associate? Well, again, it just depends on what you're paying them. It depends on how experienced they are. It depends on what area of the country you're in. It depends on your expectations. So, let's try to standardize all of this and say that in your particular situation, $3,000 per day of adjusted production is what you would consider winning. And anything that's consistently below that is what we'll call an underproducing doctor. So if we want to feel really good about this fictitious example that we're talking about, it's an associate doctor that's a great core value fit and that consistently produces over $3,000 a day in dentistry. So if that's the backdrop, if that's the standard that we're going with, how do we get our underproducing doctor, who's a great core value fit, to produce where we want him or her to produce? So again, going back to extreme ownership, going back to what's in our control, what's our responsibility. From my perspective as the owner, these are the things, got an airplane flying overhead. These are the things that I feel we need to give to our associates. So first, we need to give them the ability to perform this dentistry? And that most likely comes down to new patients. So how many new patients does a typical associate need to produce anywhere from $3,000 to $4,000 a day? It depends on so many factors, but just for the context of this conversation, let's say about 40 new patients per full-time doctor, assuming that we're talking about a bread and butter PPO practice. That has been a very good rule of thumb for me and for a lot of the clients that I coach. So, again, the first thing is, am I giving this particular associate enough new patients, enough opportunities to diagnose and treatment plan and execute on the needs of the patients in the practice? The next thing that I want to think about is facility space. Am I giving my associate enough facility capacity to do the dentistry that I expect him or her to do? That typically means that we need more than one chair for this particular associate. Now, early on in the process, I'm totally on board with giving the provider one chair as they start to figure out how dentistry is done in your particular office. That being said, it's very difficult to consistently produce over $3,000 a day if you're working out of one chair in a PPO driven practice. So I'm not suggesting that you tell your associate to put roller skates on and see 4 or 5 patients at a time. What I am suggesting is you'll eventually need to give your associate at least an overflow chair or a what we call chair two to do some of these procedures that need to be done but are not productive. For example, delivering crowns, denture adjustments, bite adjustments. When you only have one chair and there's nowhere to put these patients except for that one productive chair, you can soon start to see a third, sometimes a half of the associate's productive day go away through these types of non-productive follow-up type of appointments. So again, let's start. Are you giving this particular associate enough new patients? Are you giving this particular associate enough of a facility, chairs to perform what they need to perform? Are you giving this particular associate the right team members? Um, at least one well qualified assistant, not your worst assistant, traditionally your best assistant, and some type of overflow assistant if you get to that point. Most of my associates are routinely working out of 2 chairs with 2 competent dental assistants, and we have found that that's kind of the secret sauce, so to speak. Now, I do have associate docs that maybe just joined me out of school or that are a little bit less experienced that will work out of 1 or 1.5 chairs. And then I do have associate docs that will work out of 3 chairs. But a majority of our associates work out of 2 chairs with 2 assistants. And a majority of our associates are routinely producing $5,000 a day or more. So it's very, very possible if you give them the right amount of new patients, the right amount of chairs, and a support staff with the right amount of dental assistants. One caveat before we go on to the next part of this is when we say right amount of new patients, ideally it's 40 per doctor per month. But we're also talking about exams as well, right? So just make sure that you're giving your associate the ability to do hygiene exams, the ability to do emergency exams, and stuff like that. So those are the things that I can traditionally give to my associates. Those are the very nuts and bolts basic things. Some other higher level things that we can routinely give our associates: mentorship, assuming that you're not personally glued to the chair and you're not consumed with clinical dentistry 4 or 5 days a week. If you have some capacity for mentorship, some capacity to get into the room with them and help them with an implant, some capacity to meet with docs 15 to 20 minutes a week and talk about how this emergency exam went, or how this hygiene exam went, or just treatment plan cases. That's next level stuff, the stuff that we routinely do in our group. And then finally, the ability to afford and seek out continuing education. That's ultimately on the owner as well. So if you are doing any level of what I just talked about, then you are giving your associate doc everything they need to go from underperforming to winning. Now, what is the associate doctor's responsibility? Well, how is their skill set, right? If all they're qualified to do is 2 surface fillings and single unit crowns, the chances of them being as busy as you want them to be, or maybe even as busy as they want to be, is low. So, is their skill set expanded enough to meet the daily adjusted production goals that you both have? And if they're not, then that's on the associate. The associate needs to go out and learn how to do some basic endo, learn how to take out a tooth atraumatically, ideally learn how to place an implant, or some basic Invisalign, or some cosmetic cases, like whatever it is, right? Traditionally, early on in my career, and most of my associates that don't have a lot of experience, if they can take out a tooth painlessly and quickly meaning, let's say, within 15 to 20 minutes, and they can do so get a patient out of pain, not necessarily molar endo, that's a huge plus, but opening up a tooth, getting a patient comfortable. If you can own that skill set, you're going to be busy. You're going to have patients that want to seek you out, and your schedule is going to stay full. If you don't treat kids, if you don't do any endo, if you don't do any surgery, if you won't even consider taking out a wisdom tooth, if you're not even on your radar to do an aligner case, a class 1 crowding relapse case, and all you do is restorative and crown and like single unit crown and bridge, it's going to take a long time for you to get as busy as you want to be. So it's the associate's responsibility to open up their skill set and be open to the idea of doing more than just basic restorative dentistry. So what else is in the associate's control? Getting the patient to say yes. You can serve them as many patients as possible, but if they're not a great empathetic listener, if they have an ego, if they stand on a soapbox when they're talking to patients about their needs, if they can't figure out a way to cultivate and develop a relationship in a short period of time, then patients are not going to say yes to treatment. Now, patients may agree that treatment's needed, but they will seek out another provider to do the treatment. So I cannot control if one of my docs is not an empathetic listener or has an ego that enters the room 10 minutes before they do. I can point it out and I can insist that they work on that, and we've done that. A lot of times, docs right out of school or right out of residency, they don't know what they don't know, i.e., they think they know everything, and then they get humbled. And the ones that are open to learning from their mistakes, it's amazing to watch them grow. The ones that don't want to own anything, they don't make it. At least not with us, they don't make it. And I worry about them long term, to be quite honest with you. So that's something that the associate really needs to control. Are they an empathetic listener? Are they cultivating the relationship? Are they truly listening to what the patient's looking for? That's another classic one, right? So the patient will come in with specific needs and wants, and you could tell that the doctor is just dismissive of what the patient just said, and the doctor insists on something else. Not to suggest that that's right or wrong, but I can assure you that your case acceptance will not be nearly what it could be if that's the approach that you're going to take. So making sure that they have an expanded skill set, making sure that they're getting the patient to say yes through empathetic listening, through setting aside their ego, through really trying to develop and cultivate a relationship with the patient. And then ultimately, for me and our group, having these associates have an ownership mindset. Now, I know that this generation of younger dentists a lot of them don't want to own practices, and that's great. But they still need to have a little bit of an ownership mindset. And what do I mean by that? I mean that if they have an assistant that's struggling with something like making a temporary crown, then act like an owner and help that assistant get better at making a temporary crown. If they have an assistant or a hygienist that's struggling with a handoff, then act like an owner and spend a few minutes with those people and say, hey, look, Mary, I really need the handoff to be like this, dot, dot, dot. Because when it's not, we both look incompetent in front of the patient. It's the docs that choose not to have those constructive conversations that really struggle, and you lose the faith of the rest of the team when these docs truly don't have any type of ownership mindset. So that we have found that when we have younger associates that have a little bit of that ownership mindset, um, they can really blossom into the practice, and they really start to get the rest of the team behind them. The rest of the team starts to edify them, and they get quite busy quite quickly. So those are some things that I think are in the associate's control. So what's in neither of your control, right? So we've talked about the things that are in my control as the owner. We've talked about the things that are in the associate's control as the employee doc. Or what are some things that are in neither of our control that, and because they're in neither of our control, the stoic in me will say, why are we even talking about this? But I wanted to just briefly touch upon this. The first thing is competition. Like we can't do anything about competition of other dentists in the community. Now, I know a lot of my coaching clients are in very urban areas. That sucks from a competition perspective. It is what it is. Like, unless you plan on moving, there's nothing you can do about that. So stop worrying about that. The other thing is the economy, right? It's easy to just blame the economy, but the reality is you have no control over the economy. And the other reality is I know many dentists, um, ours to be one of some of them, that are extremely successful even when the economy is down. Why is that? Because we can relate to the patient, we empathetically listen, we can phase out treatment for them, we get out in front of the financial concerns, and we figure out ways to allow patients to get the work done in a way that's not going to put them in a financially crippling situation. So when you can pivot like that, when you can be understanding like that, you're going to be pretty busy. So in summary here, I just want to touch upon some metrics. I'm a scorecard KPI type person. I want to talk about some metrics that I think you could be tracking with your doctors on a weekly basis. We use weekly scorecards that will really help define if things are trending in the right direction or not. So again, using this example of success is $3,000 a day in adjusted production. What are some things that I love to measure or track on a weekly basis? Well, like we talked about, new patients per doctor per month, or you could even break it down to new patients per doctor per week. We said 40 per doctor per month, so that means 10 per week. Are they seeing 10 new patients per week? Put that in a scorecard and track it. I like to make sure that my docs are treatment planning enough dentistry to meet their goals. So if someone's goal is $3,000 per day in adjusted production, then we want our doctors treatment planning roughly 3 times that, or $9,000 a day. So if a doctor is working 4 days a week, 9,000 times 4 is 36,000. So on a weekly scorecard, we would want the doctors to treatment plan around $36,000 in dentistry. Now, it goes without saying, but I'm going to say it anyways, all within the core values of the office. We're not looking for treatment that's non existent. We're really being diligent about making sure that we're diagnosing specific needs of the patient. Now, if you have a doctor that is struggling to diagnose 3 times their daily goal, then you have to ask some questions. Are they rushing through exams? Do they not have enough diagnostic training to understand everything that's going on in a patient's mouth, from periodontal health to occlusion to mastication forces, obviously restorative needs, like all of those things? if I had a doctor that was routinely underdiagnosing based on the scorecard, that would be the first place I go to. Do they have enough of a diagnostic skill set? You don't know what you don't know. Many of us have gone out to Spear or Coyce or Pankey or Clinical Mastery, and you come back after a few of those courses and you start to see the oral cavity in a completely different light. There were so many things that were always there that you were just missing because you didn't have the training to identify it. So it's one of the things that we track on a regular basis. And we also like to track how much adjusted production is on the doc's schedule over the next 4 weeks, right? So again, simple math. If we're trying to do about $3,000 a day, in 4 days, that's 12 grand. In 4 weeks, that's 48 grand. Our goal is to be around 75 or 80% of that 48 grand over the next 4 weeks. And when you start to track that, you can start to see trends. And if you start to see it trending down, when you meet on a weekly basis, you start to ask questions. We were at goal here, Dr. Jones, for the last couple of months, but now we're starting to see it trend down. Why do we feel that is? And it usually comes down to the doc has gotten busy and they're now rushing through new patient exams, or they're rushing through hygiene exams. They're not diagnosing the amount of dentistry that they should, or they're rushing the relationship. They're not spending time listening. They're not spending time developing and cultivating the relationship. And we start to see the adjusted production that's scheduled for the next 4 weeks out go down. Well, that's a great opportunity to pump the brakes, take a step back, and say, hey, we got to refocus here. We cannot allow ourselves to continue down this path because you're too busy. What'll happen in 3 or 4 weeks is there won't be anything on your schedule to perform. So again, appreciate you listening. Appreciate you giving me an opportunity to kind of unpack some of the things that I talked about over the weekend with some of my private coaching clients. Really good conversations, but these are just some of the things that I'd like you to think about if you feel like you have an underperforming doc, and some tools that you can use to get them up to speed. As always, if you need anything, if you have additional questions, don't hesitate to reach out. I'll be more than happy to answer them for you. Talk soon.